Hello, and welcome back to the Wellness Pharmacist. I'm your host, Dr. Kat, and today we are exploring an important topic for many people, navigating their dietary choices. And today it's on gluten. So specifically, we'll explore the distinctions between non-celiac gluten sensitivity, or NCGS, and celiac disease. As always, we'll be looking at this through the lens of wellness, nutrition, and just overall health of our bodies and our minds. And as a disclaimer, this is just for informational purposes only. Please always consult your own healthcare team as they know you best. So let's get started by first defining what celiac disease is and, of course, what non-celiac gluten sensitivity is. So celiac disease, it's an autoimmune disorder where after we ingest gluten, there's a protein found in it, which is in like things such as wheat, barley, and rye, that cause the immune system to attack the intestinal lining and damage it. So we hear things like leaky gut syndrome and stuff, but this is an actual autoimmune disease. So when we have autoimmune, we have the body attacking a certain organ or multiple organs, and it identifies our own body as a foreign invader. So in this case, it is attacking the intestinal lining. And this can lead to very serious health issues if gluten is not completely eliminated from the diet. So that's an autoimmune disease, celiac. Now, on the flip side, we have non-celiac gluten sensitivity. This is not an autoimmune disorder, but people experience similar digestive symptoms that you would get if you had celiac, like bloating, abdominal pain, fatigue, brain fog, skin rashes, joint pain, mood issues, and the list kind of goes on. This is after, of course, we ingest gluten. And these symptoms can happen generally within 90 minutes after ingesting gluten. It doesn't have to be very much. It can be just microscopic. I have gluten sensitivity. I do not have celiac, and I do experience these symptoms. So it's within 90 minutes of ingestion, and then within 48 hours later, you tend to subside. These reactions subside if you don't continue ingesting gluten. The key difference here is that while celiac can be diagnosed through specific tests and it is autoimmune, non-celiac gluten sensitivity can't. So we have to rely on symptom tracking. So this can take a lot of time to figure out. We have to rule out other conditions first, and then we look at a person's response to a gluten-free diet. Do the symptoms get better? And then they do have a gluten challenge, where they introduce gluten, you eat gluten again, and then we see, do you have a strong reaction? If you do, and you've tested negative for celiac, then you are gluten sensitive. So now that we've clarified the differences, I would like to discuss a significant consequence for both groups, celiac and non-celiac gluten sensitivities. We have nutritional deficiencies. So again, the symptoms are very similar. Nutritional deficiencies are very similar. When we eliminate gluten from our diets, we are excluding a large amount of food, particularly in regards to healthy whole grains from our diets. Now, there are some gluten-free whole grains, but people tend to just ignore that and just get rid of grains completely. So without proper guidance, we can exclude large quantities of food from our diets, which can then lead to deficiencies in vital nutrients like fiber that we need to keep our gut and healthy and our bodies healthy. Fiber is really important for our gastrointestinal tract to reduce colon cancer risk and help just with we have a lot of our mood stabilizers like serotonin and norepinephrine in our guts for the gut-brain axis, and then that's for mental health issues like depression and anxiety. Fiber helps with that. We get a lack of B vitamins, lack of iron, and even calcium. So in both situations, you just get a nutritional deficiency if you're not careful. So additionally, let's not forget about the impact on our overall gut health. So eliminating gluten may ease some of those digestive issues that we've been experiencing, but it's important to make sure that we're replacing those gluten-containing foods with nutrient-dense alternatives. This is where a referral to a nutritionist, a dietitian is really important. And I do have a nutritionist that I see, and she's helped a lot. And you can see them online, like telehealth too. And sometimes the insurance companies will pay for it if you're listening to this in the United States. Sometimes, insurance companies will pay. So look into that. A diet that avoids gluten without the proper alternatives, the proper substitutions, this can lead to an imbalance in our, not only the vital nutrients that we get, but our gut microbiome. And I know that's like a word that people keep hearing these days, but it is really important that we have a really healthy gut microbiome to enhance our immune system, enhance our moods, prevent like diabetes, heart disease, cancer, all sorts of things. So this is vital for immune function, digestion, and even, like I said, mood regulation. So speaking of gut health, let's kind of touch on the mental health issue of all this, the psychological, and then, of course, the social implications of really going gluten-free, because I've done this and I've experienced this. So for many, this kind of going gluten-free is very isolating. It can feel very isolating, and it is very isolating because a lot of people don't understand. And what we're talking about here is when we attend social gatherings and food is generally involved, we tend to not eat, because you can't guarantee that something is gluten-free. And I've been in situations where, oh no, it's gluten-free, and then you eat it and it's not. And of course we have to suffer the consequences. So, attending social gatherings becomes anxious. It makes you anxious. Dining out, because not every restaurant, especially fast food, if you do fast food, which should be obviously at a minimum anyway for our health. However, fast food, there's all sorts of cross-contamination, and a lot of time there's just not an option for gluten-free. And so if you're traveling, this becomes a huge issue. I know traveling with my family for either trips or for business or what have you, the options sometimes just aren't there. And so you have to end up bringing your own food, and it may not be the most nutritious, or you can't have necessarily access to a refrigerator the entire time that you're traveling. It becomes a huge problem, and this can create anxiety in people as well. And then, of course, having family meals. So everybody is used to having gluten. You make 2 separate meals, one for yourself, one for your family. And then what about the expense of that? Because everything's so expensive these days. And then it, again, causes issues. So there's a lot that goes into that. The fear of cross-contamination is very real. The fear of feeling out of place and isolated is very real, and again, causes anxiety and even leads to social withdrawal. I know that I don't go out. I don't, because I don't want to hurt. So that being said, there is what I would think is a silver lining. If we're aware about, hey, we have gluten sensitivity, or if you go in and you find out you have celiac, well, then that's great too. So it's just being aware and finding ahead of time, like planning a little bit, especially in like the bigger cities where you go, and even moderate sized cities have gluten-free options. And you may not have a lot. I remember the first time I went somewhere, and it'd been years since I could eat gluten-free pancakes. That was amazing. That was in Oklahoma City. Yeah, there's a wonderful place in Oklahoma City, has gluten-free pancakes. And then I remember going to Vegas for business, and then I found a place, my family found a place that had gluten-free fried catfish. Oh my heart be still. It was delicious. It was great. And the whole place was gluten-free. So everything that they did was gluten-free. I got to eat biscuits. This is so rare and so unusual for me. And I was just in cloud 9. It was fantastic. Those things do wonders for mood and everything else. And it's not like I ate like that all the time. I eat very healthy most of the time. But to have an option, just to even have it, is just spectacular. So it's always important to kind of just prepare just a little bit before you go. I know that's cumbersome to a lot of people, but it can give you options, and that can help when you're on vacation or on business trips. So this allows for inclusion. A lot of times if you talk to restaurants too, you can get like gluten, just the patty, like a turkey burger or something like a bean burger, something like that. And then you can say, hey, I've got gluten sensitivity, and then they can clean the stovetops and that sort of thing. And I've had that happen. I was in DC with my family one time and several years back, and there was a wonderful chef in one of the busy cafeterias. And I felt guilty about it. And I mentioned, hey, I have a gluten sensitivity. Is there anything you can recommend? And he goes, oh, not a problem. Let me clean this up really quickly. What do you want? And literally he made whatever I wanted. That was phenomenal. So if you're ever in DC and you're at the Smithsonian Institute, the chefs are very accommodating, and they're wonderful, wonderful people. So ask, doesn't hurt to ask. They could tell you no, I suppose, but wherever you are, and if they do, then hopefully you'll find somewhere else that will accommodate you. So it's just a little more planning, and yet that little planning goes a long way to making you happy and your family happy. So it's important to communicate our dietary needs. And of course, it's important for our friends and family to be supportive, because I know that that's a huge thing. I know that my kids are kids and they want, I want this. And then I'm sitting there going, most of the time it's fine. It's like, okay, well, you guys get that. I just won't have it. There are some days where I just get really sad and I cry because I really want that too, and I can't. So I come up with different ways to make it at home, or we just don't go there. We go to some place that will accommodate my dietary needs. An ounce of preparation, as they say, right? So now, before anyone considers going gluten-free, especially if you suspect that you may have either celiac or a gluten sensitivity and you're non-celiac, it's really important to talk to your healthcare team, as they know you best, right? So don't just do like with exercise or anything like that. Don't just all of a sudden change what you're doing. Really talk to somebody, and potentially talk to a nutritionist if you can, or a dietitian. That would be great. They've got them that specialize in autoimmune disease too. So if you have an autoimmune disease, that would be really important to get in touch with, and they can help you. So they can guide you through, obviously, the testing. It's just a simple blood test for celiac, and then provide nutritional counseling, and then help create a balanced diet for you that ensures you're getting all the necessary nutrients and vitamins and minerals that you need. So to sum it all up, understand that celiac and non-celiac gluten sensitivity are distinct. They're separate. So celiac is autoimmune, non-celiac is not. And then recognizing the risks of these nutritional deficiencies for both, and then paying attention to your own gut microbiome and your gut health. Be mindful of the mental health aspects, the psychological and social implications of gluten, like kicking gluten out of your diet, avoiding it entirely, and taking steps to kind of mentally prepare for that before you do that. If that's what you and your healthcare team decide to do, it can help in the transition. Seriously, it helps a lot. And most importantly, again, just seek professional guidance before you make any dietary changes. Talk to your healthcare team. So that being said, there is a listener question, which I love. So let's get on to that. Can gluten sensitivity trigger autoimmune diseases, or is it primarily a separate condition? Ooh, great question. So gluten sensitivity, or non-celiac gluten sensitivity, it is obviously, we talked about, distinct from celiac. However, for some people, gluten sensitivity does coexist with autoimmune disease. That's me. I have multiple autoimmune diseases and I have gluten sensitivity. So this leads to the symptoms, right? And that can overlap. So in our autoimmune bodies, we have inflammation. And a lot of the time in certain autoimmune diseases, it can trigger this irritable bowel, or it can trigger gluten sensitivity. So they're studying that. There's not a lot of information known about this. They are studying it though, and there are more and more studies coming out about this. So fingers crossed that we find the culprit, or we find the reason why. But it does suggest, research suggests that for those living with certain autoimmune conditions, and those are Hashimoto's thyroiditis, that's rheumatoid arthritis, okay? Gluten might exacerbate symptoms due to this inflammatory or innate immune response. and leaky gut, that sort of thing. And while not everyone with gluten sensitivity develops an autoimmune disease, people living with existing and diagnosed autoimmune conditions may actually benefit from eliminating gluten from our diets. I know I did, because it helped reduce my inflammatory markers, and it did on the blood test too. And it improved my overall health. It doesn't cure me, but it does help. And it's essential to consult, again, with a healthcare professional before making any dietary changes. I can't stress that enough, especially if you suspect you have a gluten sensitivity or even an autoimmune condition. If you're having these symptoms, sometimes that's how they diagnose autoimmune. And they go, well, let's see if something else is going on. So thank you for the question. Thank you for joining me today on the Wellness Pharmacist. I hope this episode brings you clarity on gluten, and hope it empowers you in some way to make more informed decisions and choices about your health. Remember, wellness is a journey, and I'm here to support you on yours. Don't forget to subscribe, leave a review, and share this episode with someone who might need it, if you know of somebody that might need it. And until next time, take care, and we will talk soon.